How is biological age assessed? What are aging clocks? And is it beneficial to measure your telomere length? Hello everyone, and welcome to my channel. I'm Dr. Laurena, a GP and health content creator focusing on women's health and healthy longevity. Thank you for joining me in my series on the emerging field of longevity medicine. In this video, I will explore several validated and valuable biomarkers that you may want to consider while collaborating with your health provider to enhance your biological age. Biological age serves as a measurable evaluation of an organism's functional state and physiological well-being relative to its chronological age. It is determined by cumulative effects of molecular, cellular, and systemic biomarkers that reflect the aging process. To effectively assess the impact of anti-aging treatments, having a reliable method to measure biological age is crucial. This measure is intricate and complex, encompassing an individual's chronological age, health status, and medical indicators that can predict age-related morbidity and mortality. For further insights into how this relates to chronic diseases, be sure to watch this video. There isn't a single measurement for biological age. However, research suggests that 3 key parameters of biomarkers show potential for estimating biological age, particularly in individuals who age rapidly. Number 1, clinical, functional, and digital indicators. This category encompasses a variety of factors, including anthropometric measurements, blood-based biomarkers, levels of inflammation, insulin sensitivity, lipid profiles, hormonal biomarkers, cardiovascular and respiratory fitness, facial appearance, physical strength, cognitive abilities, and liver or kidney function. Additionally, validated wearable devices that track sleep patterns are included. Number 2, aging mechanism-based analysis. This approach focuses on the hallmarks of aging, which includes cellular senescence, telomere length, and mitochondrial function, as explored in this video. Number 3, omics. This encompasses various omics disciplines, including metabolomics, transcriptomics, metagenomics, proteomics, DNA methylation clocks, and multi-omics clocks. A significant study conducted in 2020 explored how 9 different methods for estimating biological age derived from 3 key parameters evolved over a 20-year period in a cohort of 845 middle-aged and older individuals in Sweden. The research evaluated 3 functional biological ages and 4 DNA methylation-based ages, along with telomere length and physiological age. What sets this study apart is its simultaneous comparisons of various methodologies while tracking changes over time. Functional data and biological samples were collected 9 times between 1986 and 2014. These findings indicated that accelerated aging appears to begin around the age of 70 based on functional measures, while other biological ages exhibited a linear increase over time. The authors also observed sex differences in the average levels of different biological ages. Women had longer telomere lengths and lower DNA methylation ages compared to men, yet performed better in 2 out of 3 functional measures. Interestingly, telomere length showed the weakest correlations in both chronological age and other measurements, while the strongest correlations were identified between the Horvath and Hannum methylation ages, as well as between the functional aging index and other 2 functional biological ages. In terms of predicting age-related mortality, the frailty index and Grimmage methylation clocks were found to be the most effective indicators, whereas telomere length proved to be the least predictive. These results suggest that methylation age and the frailty index are the most promising methods for estimating biological age, highlighting the significance of longitudinal assessments of these metrics within the same population. The key takeaway from this research is that there is no single measurement of biological age. Although many of these markers have been validated through research in various populations, their specific impact on individuals remain largely unexplored. Currently, some clinical markers, such as blood tests, physiological assessments, and functional evaluations, including metrics like blood glucose levels, blood pressure, and grip strength are primarily collected for early disease detection rather than for predictive purposes. With the aid of artificial intelligence or AI, there is significant potential for this information to enhance the predictive capabilities for doctors and researchers. It can also help analyze and interpret complex data, ultimately contributing to more accurate predictions regarding health outcomes. Another significant development is that experts in longevity medicine have established standards and guidelines for clinics for utilizing specific biomarkers to personalize assessments and interventions in this field. It is encouraging to note that some of these clinics operate under government oversight and licensing. Let's delve into the standards for longevity medicine clinics concerning health assessment and testing. These standards are categorized into 4 groups. Number 1, mandatory. Number 2, optional if resources allow. Number 3, optional and requires further validation. Number 4, not recommended outside of research settings. These categories help to ensure that assessments and interventions are both effective and reliable. These are not set in stone and will need to be updated and reviewed as more research emerges. Now let's explore what is included in the mandatory category. It's essential to pay attention to this if you encounter claims from longevity clinics. Number 1, qualified practitioners. You should be treated by a licensed doctor with a minimum of 5 years experience in their specialty, along with additional training in healthy longevity medicine, lifestyle medicine, and disease prevention. They should also possess a comprehensive understanding of biological processes underlying aging. Number 2, comprehensive assessments. A thorough assessment of your medical history, family history, and lifestyle habits should be documented. This assessment should also include a review of your history regarding screening tests, medications, and supplements. Number 3, baseline measurements. Your baseline blood pressure, pulse, and body composition should be measured. Number 4, health assessments. Evaluations of psychological, sleep, and cognitive health should also be incorporated. Number 5, blood testing. Blood tests should assess inflammatory, metabolic, cardiovascular, liver, kidney, and hormonal markers. The advantage of these measurements is that they are already employed in clinical practice to identify diseases. However, their significance in this context lies in the potential as early indicators of age-related decline. Key functional biomarkers that have been clinically validated include measurements such as grip strength, balance, and lung function tests. These assessments are crucial for a comprehensive understanding of your health status in the context of longevity. Now let's discuss what falls into the optional if resources allow category. If resources permit, the following assessments may be considered. Number 1, cardiopulmonary testing. This can provide insights into heart and lung function. Number 2, advanced cardiovascular imaging. Techniques such as MRI or CT scans can help visualize heart and vascular health. Number 3, bone mineral density testing. This assessment evaluates bone health and risk for osteoporosis. Number 4, sleep assessments. Using FDA-approved wearables, these assessments can track and analyze sleep patterns and quality. Number 5, micronutrient analysis. This evaluation helps determine nutritional deficiencies that may impact health. Number 6, oral health assessments. An evaluation of dental health can influence overall well-being. Number 7, genetic screening. For patients with a family history or high-risk genes such as ApoE, BRCA1 and 2, and familial hypercholesterolemia, genetic screening may be beneficial for proactive health management. The optional tests that require further validation include Number 1, DNA methylation clocks. Although these represent some of the earliest aging clocks, they are not yet ready for widespread use, as additional validation is necessary. You can learn more about them in this video. Number 2, other biomarkers. These are additional markers such as glycan age, cancer markers, and immune function testing, which also requires further validation. On the other hand, the following assessments are not recommended outside of research settings. Number 1, telomere length. Telomere interpretation outside of the research environment is complex and can lead to misleading conclusions. Number 2, liquid biopsies. These are still under investigation for their reliability in various applications. Number 3, senescent cell counts. Like liquid biopsies, these counts require more research to establish their clinical utility. Number 4, thermography. This imaging technique is not yet validated for routine clinical use. Number 5, non-FDA approved wearable devices. Devices for sleep other than physiological assessments that lack FDA approval should be interpreted with caution. Here's an important note. It's essential to understand that none of these tests are covered by insurance or any public healthcare system. You will need to pay for these assessments out of pocket, as aging is not classified as a disease or diagnosis. Therefore, please refrain from asking your healthcare provider to submit insurance claims for these services. If you choose to invest in your health, it is crucial to follow these recommendations. This includes collaborating with a qualified physician and a multidisciplinary team of licensed professionals such as nurses, dietitians, pharmacists, clinical psychologists, and others. While there may be direct-to-consumer tests available, opting to bypass a healthcare provider may seem like an easy way to save money, but it often leads to a false economy. From my personal experience, I've seen numerous clients spend tens of thousands of dollars on various tests, followed by additional costs for an average of 15 different supplements. A comprehensive medical history and personalized assessment could have significantly minimized both the time and financial burden, as well as reduce the mental stress associated with managing multiple supplements, a phenomenon I refer to as supplement fatigue. In summary, longevity medicine, also known as geromedicine, is an evolving field. The encouraging news is that clinicians and researchers are working together to legitimize and standardize practices within this domain. Stay tuned for my next video on gerotherapeutics, which focuses on strategies aimed at targeting the biological process of aging. If you enjoyed this video, please like, comment, and hit the notification bell for future updates. See you next time.